primary medical concerns as
Okay.
outlined.
I forgot to start the recording. I apologize. It's going now. Okay.
Hello, Courtney. My name's Judd. I'm the student pharmacist here today. I'm going to be going over your medications and seeing if we need to modify anything. Drugs are complicated. I'm here to help, basically.
Okay.
Hello, Courtney. My name is Ray, and I'm a social worker. So I'm gonna be here to help you with any assistance of food or a place to live or transportation, anything like that.
Okay.
Okay. Next, can I just have you confirm what language you prefer?
English.
English? Okay. And can I also then have you confirm your full name, date of birth, and location in which you are doing this call?
Okay. I'm at my house. My name's Courtney Grimes. My date of birth is 5/3/59.
Okay.
My pronouns are he and him.
Okay. Thank you. And are you in a safe area where you can speak openly?
Yes.
Okay. And I just want to let you know that everything that we discuss in this visit will be kept confidential, as well as the technology that we're using is HIPAA compliant and encrypted. So nothing is being recorded, nor will be shared with anyone else.
Okay.
Um, and then kind of a summary of this visit, kind of setting up about what we're going to be doing here. So we have received your current and past medical history, and we have discussed what was placed on those. It was also seeing your lab results as well. And
Okay.
as a team, we want to ask you some more questions, get a better understanding of what we saw and your current health needs. We also want to provide with some recommendations to address any concerns and improve your quality of life. Does
Okay.
that sound okay with you?
Yeah.
Okay. And do you have any concerns you would like to address before we proceed?
Well, no, not really. I mean, I was just in a couple months ago and got a shingle shot and had a bunch of blood taken for blood work. Uh, the only thing that I feel has changed is I took a fall about a week and a half ago and hit my
Oh,
face on a coffee table.
oh no, I'm sorry to hear that.
Yeah, and I've been having problems like dental problems, I guess, with this lower left jaw, but it's gotten worse after hitting my face. I went to
Okay.
the urgent care and there wasn't anything broken, so I don't know.
Okay. Okay, so maybe some might need some dental work maybe done in the
Yeah,
future.
it's been a couple of years since I've been to the dentist.
Okay. Okay. Yeah, I think that's definitely something we definitely want to discuss later on to this meeting. Is that okay with you?
Yeah.
Okay, perfect. I guess one thing that I particularly noticed was that I know you've been dealing with issues with your weight currently. I know you've been working with trying to eat healthier foods. What's your diet recently like?
Well, I started like 6 months ago. I got arthritis pretty bad in my left
Mm,
knee, and
yeah,
it's painful to walk.
yeah.
And I went to see a surgeon, orthopedic guy, and they recommended surgery, but he said I had to lose 25 pounds.
Mm-hmm.
I guess whatever they were going to do, I needed to lose the weight. So I've been trying to eat more fruits and vegetables and cut back on the red meat, but I think I've actually gained weight over the last 6 months. I sure haven't lost any.
Oh, I'm sorry to hear that. Have you been sedentary? Have you been able to exercise? I know you said that your knees have been hurting.
Yeah, I mean, I just can't really get motivated to do any exercise at home. I'm tired
Okay.
all the time. I can't
Yeah.
really afford a gym.
Hmm. Have you been able to do any like low impact type of exercises? I know with your knee, running would be quite hard to do, but have you done any type of like aerobics?
No.
No?
I mean, no, like I said, I'm tired. I feel
Yeah.
fatigued. I'm
Okay.
just not motivated to do any of that at home.
I'm sorry to hear that.
Yeah.
Let's see here. Has with the motivation, has that been impacted by the pain in your knees?
Yeah, maybe a little.
Okay.
I haven't felt motivated to do much of anything, I think, since
Yeah.
after the pandemic started.
Oh yeah. Have you been
I gained a
isolated?
bunch of, well, I mean, yeah, we all were for a while. And then,
Yeah.
you know, I was off work for a while. I mean, I'm back working
Mhm.
every day, but
Okay.
it, you know, I just lost interest in doing much of anything, to be honest with you.
Yeah. Have you been applying any type of like heating or cooling to your knees?
No.
No? Are you interested in maybe trying like a gel? It's called like Voltaren. You can provide some of that kind of some relief for you, so you're not feeling so heavy and you're not feeling so much pain on those knees.
Yeah, I mean,
Yeah?
if it doesn't cost an arm and a leg, I'd try something. You bet.
Okay. Okay. And then I know you had talked about fruits and vegetables being kind of difficult to pay for them. Have you been using any, where are you getting your produce?
Well, the closest grocery store to me is the Whole Foods,
Oh, yeah.
and that stuff's, I mean, everything's expensive. It's like even a dozen eggs is costing $4
Mm,
nowadays. It's
yeah.
you know, I mean, we pretty much, my wife and I pretty much live paycheck to paycheck, so it's been a
Mm,
struggle
yeah, I
trying to
can.
get, you know, trying to get eat healthier.
Yeah, no, I definitely understand. Is there any way we could maybe provide you some resources to provide to maybe obtain food and healthy food in a cheaper way, where you don't have to go to Whole Foods and pay $5 for an apple? Are you
Yeah,
interested in something like that?
I mean, I'm not looking for any handouts, but yeah, if
No,
there are some resources, that would be great.
definitely.
That'd be
Okay.
great.
Yeah, we could provide you some resources at the end of this. Hopefully that will help you with your weight, help as well as with the gel. Might help you move around a bit more, help you lose a little bit more of that weight by exercising a bit. I know
Okay.
with the pain can be hard. And then as well as with the food, we can help with that as well. Does that sound good?
Yeah.
Okay. I think Judd's next.
Yep, I'll go next. All right, Courtney. If I didn't mention it earlier, my pronouns are he, him, his. I don't think I said that
Okay.
earlier. So I'm just gonna be going over your medications, providing some recommendations. Just want to start about like seeing what medications that you're taking right now. Specifically, I just want to talk about, I'm just gonna go down the list and ask you some
Okay.
questions. So for the metformin, what have you been taking that medication for?
That's for the diabetes. It's 1,000 milligrams, and I take it twice a day,
Perfect. What times of day do you take it?
just in the morning and like right before dinner.
Okay, perfect. Next one is the sitagliptin. You
I take
probably
that
get
in
it
the
as
morning.
Januvia in the morning.
Yeah.
What strength do you take of it?
Um, and I don't know. Let me see if I can see it. It's 100 milligrams.
Perfect. Okay, this next one's the combination pill. It's the amlodipine benzapril.
Yeah. That I just take. I take that once a day. I mean, I forget to take it once in a while. You
Okay,
know, less than once. I mean, I take it. I might miss 3 or 4 times a month.
okay,
And the dose on that, let me see what the bottle says, is 5 of the amlodipine and 20 of the second.
perfect. Yeah, benzapril. For that one, have you been having any side effects with that one? How's it been working for you?
Yeah, I guess it's been working okay. You
Okay,
know, I take my blood pressure probably 4 times a week. And it's, I mean, I add it up at the end of the week, it comes out to like 142/88 or something like that, averaged over the week. I mean, sometimes it's higher, sometimes it's a little lower.
when you're taking your blood pressure, how do you take it?
I've got one of those little things, battery pack things that you put on and it blows up and tells you the number. I just put
Hmm.
it on when I'm watching TV.
Gotcha. Are you sitting down when you were watching TV, or are you like standing up?
No, I'm sitting down most of the time.
Okay, good. And you're just totally relaxed when you take it? Nothing crazy
I
like that?
guess I'm
Okay,
just sitting there.
gotcha. Okay, next one I want to talk to you about is the simvastatin. How do you take that one?
I take that in the morning too. That's 20 milligrams just once a day.
Okay, and these last two, the Tylenol. How have you been taking that one?
I'm taking 3 of those a day. I don't know, 2 or 3 times a week. And then the naproxen I was just taking when the knee pain was getting real bad, a couple, 3 times a month. But since I smashed my face on the coffee table, I've been taking it every day, twice
Gotcha.
a
Okay.
day. But it really, that stuff works pretty good. Not so much with the knee, but it helps with the jaw pain.
Mm-hmm. Yeah, so that one is an NSAID, kind of how Jennifer was talking about. We could try and use the Voltaren gel instead, and try to have you use that one a little bit less.
Could I put it
There,
on my jaw?
I wouldn't recommend putting it in your jaw for the Voltaren gel. I think it's just specifically for the knee. I would refer to your dentist about that. But yeah, no, I wouldn't use it for the jaw.
Okay.
But yeah, for the naproxen in particular, there is some risk for like a GI bleed, just like a stomach bleed, which is something that we really want to avoid. So if we could try and like wean you off that a little bit, that'd be
Okay.
awesome. Have you been having any side effects with I think I missed a few with your metformin, anything like that? How's it been working for you?
I guess it's working okay.
Okay. How have you been checking your blood sugar?
Well, I got the little finger poke thing. I check it just periodically, randomly, I guess, sometimes in the morning, sometimes after a meal.
Okay.
It's usually like 110 in the mornings, and then it varies up to, like 240 or something after a meal.
Okay. When you're checking in the morning, is that before or after a meal?
It's before I eat.
Before.
Yeah.
Okay. Good, good, good. Okay. Um, and then have you been having any side effects with the simvastatin? Just been working for you good?
As far as I know,
Okay, cool.
I
Got
haven't
all
seen
those
any of the
signs.
latest lab work, so I don't know.
Mm-hmm. Yeah.
Not that I would know what it means anyway.
Yeah, I can help you with that one too. Today I really wanted to focus on the hypertension and the diabetes, but I can talk about the dyslipidemia too. Let's start with the hypertension. So that's your blood pressure. So you've been telling me that you've been taking it regularly, and you are measuring your blood pressure correctly, which I love to see. You said that you feel like your medications are working for you. However, I would like to see your blood pressure is a little bit lower.
Okay.
Um, so how we can do that, first of all, make sure that you're taking your medications like as prescribed, which you seem to be doing. You said you miss your amlodipine and benzapril like maybe 3 or 4 times a month.
Yeah.
One way we can help avoid that is if you take your medications all together in the morning, because you're taking your diabetes medications in the morning regularly. You're not forgetting those. So you could take the amlodipine and the benzapril with those other ones and just group them all together. That's one way you could remember. Another method is you could use a pill bottle. I
Yeah,
have a
I
lot of
should get one of those.
yeah, you can get them at a pharmacy or really any supermarket. A lot of my patients use them. They really like them. Uh, so yeah, that would be one way to control your blood pressure. If we wanted to, we also could increase the dosage for one of your medications, your amlodipine benzapril. The amlodipine dose, that's good. Your benzapril though, I might want to lift that up a little bit. So that would be one way of uh, addressing your blood pressure.
Okay.
But I would want to wait until after um you are taking the amlodipine and benzapril regularly 100% before we really look into that. The other thing I
Okay.
wanted to talk to you about was your blood sugar. So I like that you're taking both before a meal and after a meal because those are both really important blood sugars to take. They are a little bit elevated, and that and it seems like you're taking your medications for your diabetes. You're adherent to all of them.
Yeah, I
I
never
was
miss a
thinking,
dose of that.
yeah, you're really good on those, which is awesome. We love to see that. A lot of people, I think the average adherence rate's like about 80%, and you seem to be at 100% for those ones, which is really great. Love it.
Okay.
I would like to see those blood sugars go down a little bit though, just because they're a little elevated. We could add another medication to your current regime called a GLP-1 agonist. It does a whole lot of things. So it's going to help control your blood sugar. It also is going to help adjust your obesity. It's used in weight loss. So 2 birds, 1 stone. And for you in particular, it's going to be really good because it has a lot of, it prevents cardiovascular disease for a lot of patients. So, and you have a few risk factors for cardiovascular disease specifically.
Yeah, my dad died of a heart attack.
I was gonna say, yeah, you
in
have a
his
family history of
70s.
that. Yeah. And the hypertension is something I'd be worried about that too. But yeah, that's something I definitely would recommend you talk to your doctor about. When are you seeing your doctor next?
I don't know. I mean, they scheduled me this with you guys instead of going back into the doctor's office. So
Gotcha.
I guess I
Okay.
could go see him anytime.
Okay, yeah, that would be something I'd recommend that you talk with your provider about. Because
Okay.
again, I'm a pharmacist, I can't prescribe things. Um, so that would be something I'd recommend that you possibly talk about. And then you also mentioned your simvastatin. I can go over those levels. So right now, most of your levels for your cholesterol are pretty good. Your LDL though is a little elevated. So one way we could address that would be like lifestyle changes. So kind of like what Jennifer was talking about, being a little bit more active, also having a better diet, which we can get you the resources to help you with that. We could increase your statin. Right now you're at a low dose statin. We could crank it up a little bit to help get those LDLs under control. Again, that would be something that you'd want to talk to your provider about.
Okay.
But I'd recommend talking about that. Probably like a torvastatin 40 is where I would go from your simvastatin 20.
Okay.
And then specifically, I want to really focus on the hypertension and the diabetes, because if you don't get those under control, it can have like some really big impacts on your life. Specifically, if you have like uncontrolled hypertension and uncontrolled diabetes, it can cause all sorts of organ damage. Right now, I was just looking over your labs, and one of your indicators for your kidneys, your urine albumin creatinine ratio, that's some fancy words, that are just kind of looking at your how well your like kidneys are working. They jumped up recently from about a year ago, which makes me kind of worried about some possible organ damage. I'd recommend running some more tests though. We're gonna have, I think Jennifer's gonna talk to you about that some more at the end, but something
And now
definitely
you're
to look
scaring
at.
me. Okay.
Yeah,
Oh,
no,
I
it's
can
important.
actually, yeah, I can jump in real quick. Sorry, Judd, if that's okay with you. I just want to make sure. Yeah, as of right now, you shouldn't be that concerned. We're not seeing any end organ damage. Nothing like that. It's just a little bit elevated, more
Oh,
than
okay.
that's normal. So we're just wanting to, observe it, make sure it doesn't increase anymore. I mean, it's
Okay.
normal as when you get older, your kidneys don't function as well anymore. They kind of get a little bit tired. So we want to
Okay.
make sure that we're monitoring them, specifically because we keep on making a lot of these medication changes. So we just want to make
Okay.
sure. So part of that is I'm gonna recommend getting urine analysis. That'll just give us a little bit more information about if there's any issues with filtering in your kidneys, and then we can go from there. If we need to have you see a urologist, then that's something we can talk about in the future. But as of right now, I wouldn't be concerned. There's no end organ damage or anything like that. Jed was just
Okay.
making a recommendation. Yeah, no, I just wanna
Some good
make sure.
news.
Yeah, I just want to make sure you understand.
Okay.
Yeah, no, not end organ damage. Just like it is a thing that we should be watching out for. Is what
Okay.
I was trying to say. It's just like
Okay.
something to watch out for. Yeah, no, not end organ damage, just organ damage possible. Like I was saying though, I think I actually covered everything I wanted to talk about. In that case, we'll go on to Soham then.
Okay. Again, my name is Soham. I don't think I actually mentioned my pronouns earlier, but my pronouns are he, him.
Okay.
I just wanted to talk to you, Courtney, about just the things that have sort of have an impact on your overall energy and day-to-day lifestyle. So it seems like, as you mentioned earlier, that you and your wife live paycheck to paycheck. It seems a little bit tough to, get healthy food in a affordable manner. You've recently suffered a fall, which has obviously had an impact on your life, and I am very sorry to hear that.
Thank you.
Ever since the COVID-19 pandemic, however, I made a note here that uh, overall you've been pretty disengaged with things, and these are things that normally you were happy doing.
Yeah.
Do you mind talking about that just a little bit more?
Well, no, I don't mind it. It just, I don't know. It's, I mean, a lot of the stuff I like to do, I'm just not that interested in doing much anymore. I'm tired all the time. It, you know, I mean, I've kind of lost interest in intimacy with my wife,
Mm,
both gaining a bunch of weight since the pandemic. I don't think it's just me. Everybody I know is gaining a bunch of weight.
absolutely. Yeah.
Um, so I've just kind of seemed disinterested in stuff.
Yeah, and staying home for extended periods of time, it almost never has a good impact on just anyone. So,
Yeah.
so yeah, I can understand that. And I also made a note here that you do have difficulty falling asleep, but you have no problem waking up. Is that correct?
Yeah. I mean, once I get to sleep, I sleep pretty good. It's just sometimes, and most of the time, I just lay there, have trouble getting to sleep.
Yeah. So do you experience any kind of fatigue when you wake up, or like just even though
I'm
you are
tired all the time.
okay, okay. And could you tell me more just about like your overall energy levels during the day?
Well, like I said, I'm tired all the time. I mean, I get up, I
Mm,
jump in the shower, I got to be to work at 7 o'clock. I limp through the parking lot and sit on my bench and make auto parts until 3:30. Then I come home and grab a snack and then eat some dinner and watch some TV.
yeah. So it sounds like it could take a toll on your body, the work that you're doing.
Well, it's not that difficult. I'm just sitting there
Mm,
doing repetitive things.
right, right. Okay. Um, and you also have mentioned that you've experienced weight changes. Even though you're trying to lose weight, you ended up gaining some weight, correct?
Yeah.
Okay.
Yes, I did.
So now I don't want to uh, unnecessarily raise your stress levels, but I am a little concerned about you exhibiting symptoms of what could be depression.
Okay.
Just want to ask you, just to clarify the time frame. I don't want to just assume that it's been going on since the COVID-19 pandemic. So could you just tell me roughly how long you've been experiencing the symptoms?
I think it started, couple years ago, 2.5 years ago, kind of along with the pandemic. It was just kind of a shocker. And then it just went on and on and on.
Okay.
Uh, you know, it's just kind of been continuing.
Okay. So I just want to let you know that normally we are on alert if symptoms like this persist more than 6 months, and definitely we are suspicious of what could be depression if it persists more than a year.
Okay.
Fortunately, there are ways that we can address this. Now, normally, you may have heard of a drug called Lexapro. It's
Not really.
okay, no worries. It's a selective serotonin reuptake inhibitor. It basically just um, it basically just modifies your serotonin levels that could help improve your mood um, daily.
Whatever that means.
um, so there
It's
are
a,
basically
it'll improve my mood.
yeah. So it's a
Okay.
pharmacological method to improve
Okay.
mood. But before jumping right into that, I like to ask, would you be interested in non-pharmacological methods such as therapy?
I mean, I've never really thought about it.
Okay, because
I
if you
suppose it
are,
wouldn't
we can
hurt
refer
anything
you.
if it doesn't cost a whole bunch of money.
Yeah, yeah, and I think Sarin here, in charge of social work, I'm sure she would be able to help you as far as finances are concerned. But if you are interested in therapy, we could initiate that process before jumping right into administering an SSRI.
Yeah, okay.
Okay, so I just want to let you know that those are some options that we have available, and that's what I was looking more towards.
Okay.
Okay. All right, and I think Sarin would take it away from here.
Hey, Courtney. I'm Sarah
Hello.
work. If I didn't pronounce, I go by she or her, and I'm a social worker. The doctor has sent me here saying that you have a little concern about your insurance and then eating healthy food. So I will be researching. May I please ask you what city are you live in?
Detroit.
Detroit. Okay, and then I will be researching some information and then send you over at the end of the our appointment.
Okay. I need something. I need to see the dentist.
Oh, and what kind of insurance do you have right
I
now?
don't have any dental insurance.
No
I mean,
insurance.
I've got health insurance through my job, but it's got kind of high deductibles.
Okay, and that's the something I will research too and find you affordable tenant.
Yeah, that'd be great.
Okay.
Okay, Courtney. I think that's done with any of the concerns that we saw. Is there any concerns that you would also like to discuss before we move on to our plan?
No, I mean, I really can't think of anything.
Okay. So kind of just summarizing what is going to happen after this. So Saran is going to contact you in a few days regarding information about how to receive some insurance, some help also with getting some food in a cheaper way than what you've been acquiring recently, as well as helping
Okay.
with that dental, making sure that you receive some type of dental services. I know you've been experiencing pain even before you had this accident of falling down. So we're gonna try to get you whatever we can regarding the dentistry. I know some places also have some free dentistry work that can be done too.
Okay.
So she's gonna work with you about that. And then I'm gonna bring out some maybe an exercise plan for you, some low impact. I know we discussed about maybe doing some aerobics, helping out with the weight loss, as well as talk about give you a script for Voltaren gel, or at least have you discuss that with your physician when you see him next, as well
Okay.
as we will be sending out information about the alteration of medications, like Judd discussed, to help out with your hypertension as well as your diabetes, help control that. And then we're also going to look into maybe possible places that you can gain therapy to help you with your low mood, maybe help you feel a little bit more energized. And I think that is all our plans for right now. Any questions
Okay.
regarding those?
No, that all sounds pretty good.
Okay, and then I guess one last thing, we're also going to have you go and do a urine analysis. Like I discussed, we just want to monitor your kidney function, making sure that no alterations have been done since you've last done the blood test. I know it's been only a couple of months, but we just want to keep on monitoring it. If we see any changes, we're going to contact you, and then we'll have a discussion about maybe following up with the urologist, okay?
Okay.
Okay. So we just want to thank you for taking the time to meet with us. We take great pride in providing our patients with exceptional care, and we're looking forward to working with you to address your health concerns. In addition, we'll provide you with a written document about what summarizes this visit and our current plans moving forward. Would you prefer to receive this by email, fax, or post mail?
You can just put it on the Teams chat.
Teams chat. Okay, awesome. Thank you.
Okay. I guess that's a wrap.
Yes, it was very nice meeting you, Courtney.
Okay, nice meeting you. I'm gonna let the recording run a little bit if you guys
Okay.
have any final thoughts or anything. And then I will probably see you back at Cato in the future.
Okay, sounds good.
Okay, bye.
Bye. Okay,
That
guys.
did great.
Thank you.
Nice
You did
job.
too.
The doctor, the pharmacist, and which one? So doctor, pharmacist,
think we're only doctor, pharmacist, and social work, right?
Mhm.
Awesome.
We need a dentist, and then it'd be the full team.
Dentist was such a necessity on this one too. Okay, let's see here.
But Saran, I think you
Um,
did a great job of handling it though, and saying, "Hey, like we'll get you some dental care, get you to the dentist, and they can all handle it," which is awesome.
Okay.
My heart was beating.
Same.
Okay, so what are we supposed to do next?
Yeah, we have some post visit stuff. I know we have like a post visit survey, but I think we can do that individually. We do have some group stuff to do.
The assignment 1, right?
Yeah.
Okay, so we have the visit agenda. We kind of already created that. I could pretty much fill that in. That shouldn't take me too much time. I can fill that in, guys, and kind of send it through. But we do need to create a patient care plan. So, okay. Is there any way we can do this? Is there any way we can like work together on this?
I wish it.
Unless
Sorry,
we
go on.
like copy and paste it into a Google Doc.
Would that work? Let me see.
I'm hoping it
man.
works. I
My
wish it
thing's
was
not.
I was gonna say I wish it was like a Microsoft Word doc, because I know you can convert those to Google fairly easily.
Yeah, my thing's not working. Is it working for you, so?
Oh, what's
My
not
computer
working
is
for you?
like, no. I'm trying to like copy it and put it in like a Google Doc. It's just not working for me though.
Oh, it's gonna be hard to copy paste it because they have like tables and stuff.
So maybe we should have like one person fill it out and everyone just say what.
Yeah, so what I was thinking is so you know how the table has concern, goal, interventions, monitor? So we
Yeah,
could just like type that in ourselves on the Google Doc and then just copy paste it into the table. Like one of us would just copy paste into the table, probably take like 2 minutes.
perfect. Okay. So Google Doc.
Did you guys share a Google Doc?
We can do that. Okay, can someone else do it? I'm so sorry, guys. My computer's just not functioning with me right now. I have way too many things open.
Yeah, I can share it.
Thank you so much. I'm so sorry. I'm trying.
No worries.
Okay. And then while you're doing that, we also need to do a reflection, right?
Mhm. Okay, do you guys mind sharing your driving for your Google account?
Do it in the chat.
Yeah, whatever works easiest.
Okay.
I'll send mine in the chat.
And kind of while you're doing that, Tom, is it okay if if we talk about just like debrief about how we thought it went?
Are we doing for all these? It's just one per team, right?
Yeah,
So we're
one
doing
person.
okay.
Yeah, just one person's gonna do it. Like I said, I can pretty much do. I can fill out the visit agenda because I have that all what we talked about in my
Yeah.
Google Doc. That'd be really quick for me to put it in. Um, the patient care plan, something that we might need to work
Mhm.
on with. And then we also need to send a reflection about how we thought things were going. I think we have the questions about that reflection here. So I can also put that in like a Google Doc real fast, and I can send that in with everything else.
Did you receive my email?
Yeah, I got it, but I was wondering if you had a Gmail account so you can.
Okay.
Okay, got it. Thank you.
Thank you.
Okay, I just shared it.
Awesome. Thank you so much, Soham.
Yeah, of course.
And then I'm going to copy and paste those reflection questions on this document too. So we kind of get 2 assignments done in one bit. We don't have to make like 2 separate documents.
Okay.
Do we want to answer those reflection questions together or like split them up? Because I think there's 4 of them, right?
I honestly think maybe we should just discuss it together. Might be a little bit easier to just kind of go down what we all think versus doing it separately. But I'm up for whatever everyone else wants to do.
Yeah, no, I agree. Because I think it's important, especially like the one question about like barriers. Like, I think that's something that we all should be talking about.
Do you guys want to do the reflection first, just because now we have like the whole entire thing fresh in our heads before we start moving on to everything else?
Yeah, that sounds like a plan.
Awesome. Okay, so I think the first question is explain the advantages and challenges of working as a team to provide care to the patient. So I guess we could do advantages first.
Okay, I'm lost again. Are we still in the assignment one?
Yeah, I think what we're doing is we're doing assignment 1 all in one Google Doc, and then I'm just going to, at the very end of this, just copy and paste everything into like separate assignments so that I can just send it in all together.
Okay.
Yeah.
The question that you just read,
Yes.
where is that at?
In the Google Doc, it's going to be kind of on, it's like reflection, and then there's 4 bullet points.
Okay. It's still on the assignment one?
Yeah, it's still in the Google Doc that we created.
Oh.
Yeah, I copied and pasted all the questions for the assignment 1 onto the Google Doc. So
Oh.
just that we don't have to go back and forth.
Okay.
Yeah.
My phone about now.
So like one advantage for me at least is like bouncing ideas off of everyone else. I thought was really helpful because I had like maybe one idea of treatment and then other people would have others. Specifically I think like with Jennifer with the Voltaren gel, that was a good idea.
I think also like I know there's certain things that we're all really like specialized on in, and there's things that I would never even think about like bringing up. So very similar to what you said, Judd, that like going over those medications, being able to like kind of decipher which medications should be changed or how they should be changed, I think was a great advantage. Just because I don't have as much experience regarding that.
For me, oh, I go next.
Yeah, go ahead.
For me, it was like really like interesting, special, like cause I work at DMC at psych unit, but like I observe, but actually doing it, and actually like seeing it, you guys doing like it's really like it's just made me feel something. I don't know how to describe the feeling, but it really like touched me.
Yeah, I'll just like kind of add on to that. I think everyone just had like a piece of knowledge that they knew more than the rest of the group, which kind of complemented each other very well in terms of providing whatever feedback that we provided to the patient. Um, that was pretty much the main advantage. And I think that most of the challenges, particularly just like knowing um, who goes after who. That stuff could probably be solved just by like having more time to interact with each other prior to the visit. But overall, the advantages, in my opinion, were far greater than the challenges.
Oh yeah, he really said it. Communication. Because as I said, I work at the hospital, you will see the doctors come first with the team and then the psychiatrist. And it says, like, if they not communicating exactly what's going on, if a social worker come to the patient like that, not knowing what, like, he or she's supposed to address with the patient, it will be kind of difficult. So I feel like communication can be a challenge.
Yeah, I think that is a big thing too, is that like because we've only met each other for what, like
Yeah.
30 minutes prior. We don't all know what our specialties are. Like we don't know what our broad I also like what our knowledge is as well. So like trying to like figure that out in the midst of also trying to like, provide care to this patient, I think was also a bit difficult. Just because trying to find the even ground, I think it's something that was a little bit challenging. Also, I feel like when it's online, it's just so much harder too.
Mhm.
100% agree. Yeah, because I'm like constantly like, okay, can I unmute myself now? Like, what's happening? And like, there's just a lack of like, I mean, I was gonna say there's no face to face, but like, you can see my face. But being in the room with someone, like, you can get all like the nonverbal
Mhm.
information, and that was like hard to gather.
Also, I'm so sorry I like went into your conversation. He just started panicking. I'm like, I hope this guy knows he's not dying.
Yeah, no. Like,
I'm so
I shouldn't
sorry.
have said organ damage. I should have said like generalized vascular dysfunction, maybe. Because like, yeah, no, I meant
No, you
like it
did
could progress to
wonderful.
that, and well, I didn't want to say you had it right now. Yeah, no,
No,
that
you
was
did
good though.
great. Honestly, you did amazing. But
Yeah.
yes, he's
This is
breaking this down.
When he brought up the dyslipidemia, I was like, okay, I could talk about that too, I guess. I don't know. But yeah, thank
Yeah,
you.
I think that was also difficult too. I thought was like trying to find where to talk about things. Like when I was talking about obesity, he wanted to bring up depression, and it was like, yeah, I want to talk about depression, but like someone's gonna like go way more in depth about it. And then he talked about the dyslipidemia, and I was like, yeah, we're gonna talk about the labs at the end, but like because it's right there, we should probably discuss it. I thought that was also a little bit just challenging in itself, trying to figure out like where we're gonna talk about things and like the placement of it.
But in the end, we got all of it because I mean,
Oh yeah,
Soham like nailed down the depression stuff. I thought it was just excellent.
it was
Way
great.
better than I could have done. Um, and then with Saran, we got all the insurance stuff, so that got all dental. Like, I feel like we didn't. I mean, other than I could have done vaccines, but like that's fine. That's kind of like more. There's more pressing matters specifically with like the dental work and then like the chronic disease states. Um, but yeah, I think we handled everything though, other than the vaccines.
Yeah, we did great. Okay, I
Quick
think then
question.
yes.
So do we just want to set like a time frame by which we want to finish assignment one? Because I know there's like a lot of time that they gave us for us to submit it. So if you guys like prefer, I don't know, some of you want to finish it early or wait, or um, if we just set like a time limit for ourselves, then we can just get it done by that date, right?
Yeah, I think honestly by the end Personally, I prefer by the end of this week, just because I don't want to like keep on pushing it back and then forget about it. And I know I don't know about you guys, but like we're hypothetically still kind of on break right now, even though we have other things kind of to do. So I kind of want to get it done now before we start like really starting our orientation stuff and whatnot. But I am open to anything. I just know I think I'm gonna get at least a part of my stuff done by the end of the week.
Yeah, that works for me too.
I think I think our thing is gonna be done in like 4 minutes. Do you guys want to do a Zoom call to finish or at least or talk about this reflection, or what do you guys want to do?
Yeah. Oh, we need to. Oh, it's time for us to leave this.
I think so, at least I could be wrong, guys, but didn't it say like 5 minutes until this meeting closes?
Yeah.
Yeah. I think it's because we started early. Yeah, I guess we can just keep on going though until this closes. Yeah, so I guess the next question is explain how the team optimized their ability to function during the visit.
I think it kind of ties into like what I mentioned earlier. We kind of just complemented each other, and that's how like we sort of optimized how we could provide adequate care to the patient. Because like I think Judd and Jennifer, you guys had like a good example right there, where like Jennifer stepped in to um, clarify certain things to the patient, and I think that was like a perfect example of how we were able to provide the best quality care.
Okay. And then the next question is explain any barriers that hindered the team from accomplishing the visit agenda.
I was gonna mention, like, for that one, I think just the medium of being online hindered it a little bit. Just because like even though like we were butting into each other, like it still worked out in the end. Um like if we had been like in the same room together, I could have like looked over at you and like had like a non-verbal communication, be like, yeah, you can take it. I know you sent me like a text in the group chat about it. I wasn't even looking at my phone at all during it, which if I was looking at my phone, that would have been a benefit, but I wasn't. But yeah, like again, the nonverbal stuff, like I could have just looked over, inferred that, and then let you take over. And then another one specific for our team, I guess, could be not having the dental student. That would have really helped because we had a big knowledge gap for the dental. Like it sounded serious. They probably should have seen a dentist, but I couldn't have told you anything else other than that.
And it's kind of unfortunate because that was kind of his main, like his chief complaint was the dentistry. And I was like, I don't know how to help you with this. Sounds serious. Yeah, it sounds like you need to see the dentist.
I
Okay,
think it might cut out on us soon now.
So who's gonna send the Zoom link?
I can send a Zoom link if everyone wants to continue doing like at least finishing at least a good portion of this. Okay, solid. I'll send a Zoom link then. When this closes, I'll send it via email.
Okay.
Slay.
So
Unless it's not.
I feel like it's not gonna automatically close. If you guys want to
Is it
stay on,
not?
yeah, it's still on.
Oh,
Yeah, I thought it would like automatically close at 5:15.
yeah, same.
It
Okay.
won't take us that
Guess
long.
it's not. Guess it's not like Zoom that just kicks you off.
Yeah.
Okay. I guess in our last question, identify and explain a minimum of 2 lessons your team learned about collaboration, ability to function as a team. I guess like it's the importance of like communication in the beginning of starting the meeting to understand where each of us could shine and each of us could like help the patient to our best ability. I think the open communication in the beginning was like so needed. I'm honestly happy we had the additional 15 minutes just to make sure we had like a plan before we saw the patient.
Yes, because I was really lost.
I don't know how to word that very well, but let's fix this up before we go. I'll clean that up before I send it in. But anything else? What's our second lesson? The importance of a thorough review.
I think the main value that we sort of provided to the patient as a team was that even if like we weren't sure about something, we were always constantly able to reassure the patient that, okay, I don't know, I'm not completely sure of this, but like Judd here could help you out, or Sarah here could help you out. Like I know that happened many times when he was talking about like his finances being tight, and particularly when we talked about therapy, that he wasn't sure he was going to afford it, but we were able to immediately kind of reassure him that Saren would be able to help you out as far as finances are concerned. So that's like one big lesson that I kind of took away from this, that there's a lot of value to be provided to the patient when you have multiple people working together.
Yeah, I think that's a big thing because I know like whenever we're in like a room with a patient, a big thing is like we tell them we'll provide you resources, but like at the end of the day, we're not able to actually show them directly to a person that can readily provide them the resources. So I thought that was really cool that we had the ability to be like, yeah, we actually have a social worker on this call that could help you with that. Like that's a really unique thing. And really, I wish that we a lot of hospitals or a lot of clinics had the ability to like actually give them social work and care right there during the actual meeting. Okay, I think that's done for reflection, right? Sweet. Okay. Next.
Yeah, I think it looks good.
Okay. I like I said, I can spiff it up a bit before I send it in. But at least we get like what we want to say on there. Okay. Next is what was the next one? The patient care plan, right? Okay. So do each of us want to just go to the concern that we talked about during this thing and just kind of write what we perfect. Okay. So we can do concern.
This page.
No, that'd be the other one. I guess honestly, I'm gonna be copy and pasting most of what we say for the other section, which is the patient care plan. Patient care plan is pretty much exactly what the pre-visit thing was, but it's a little bit more in depth. It's the let's see, maybe this is what you bringing up. Yes, yeah, that one. Yep, that one. So I can put.
Should I make hypertension, diabetes like one concern or split it up into two?
Maybe split into two.
Agreed.
Yeah, because I think we needed like 5 concerns, I think was kind of what we were looking at.
Should I would like Saran, would you be doing one of these for like dental and like the social work stuff? Would that be like concern 5 then?
Yeah, I guess concern 5, could we do just like inability to receive care? Could that be one of the concerns? Yeah. Yeah, perfect.
And then basically we'll just like write down our stuff and our corresponding numbers. So like, yeah, you guys are already starting that. So like I'll be doing 3 and 4. Jennifer, you have 1. So you got 2, and then Saran, you can do 5 then, and just go down like that.
Okay. So right here. Mm.
Yeah, I can see your cursor. Yep, right there. And then Jennifer, you're gonna take what we write on this Google Doc and you're gonna copy and paste it onto the PDF and then turn it in.
Yeah, I'll turn it in.
Coolio. Okay, I probably won't get this done until towards the end of this week. I have an infectious disease exam on Wednesday that I'm kind of stressed out about. And then I also have like a random other exam that was supposed to happen last Friday, but the university shut down due to the weather. They have not told us when that exam is going to happen, so who knows how that's going to work. Either they're going to have to do it really late on Friday or push it off until after. I have spring break next week from like the 12th to the 18th. Um I I'll try and do it probably Friday evening if I can. I'll be like traveling from like the 11th to the 14th. So like the latest I'll have it done is like the 15th.
Yeah,
But
no
I'll try and get
stress.
done in 10th. Yeah.
No stress. As long it's like, I would love it for it to be like a week before the 26th, just so that if anything happens, like we can like, modify things, or if anything needs to be altered in any way. Yeah, so like a week before the 26th, but like honestly, don't stress. You have all these exams, it's like completely fine. So if you have to like leave right now, completely. Honestly, I think we're good on being on this call. I think everyone knows what we're supposed to be doing, unless someone has any questions before we go off of it. Are y'all good?
I do. So
Okay.
best.
Oh, yeah, go ahead.
So basically, I will be putting down what to help her. I mean, it was her. Right? What what to
Yeah.
help? I mean, the case is her, but the person is here. But what to help her as the insurance part, and then the healthy food, right?
So that's the barriers. So the concern, I think we already have it, but like just explain the barriers to the care, like lack of insurance, specifically dental insurance, and lack of like actual like whatever, however you want to word it. But like put that down behind the barriers to care. And then in number 5, the goal of the outcomes, so like how to what's the goal of like actually addressing these barriers of care, and then following up with like interventions, what you think we should be done to help this patient. And just put them down number fives, all these number 5 ones, and then I can just copy and paste it into the document and send it in.
Okay.
Yeah. If anyone has any questions, like we still have the oh gosh, the not group me, but the group message. So if you guys want to like just like write questions down, we can always answer those as well. Okay, awesome. Well, I hope you guys have a good rest of your Monday. Great job. I think we did an amazing job. Specifically because we had like 30 minutes to figure this out. So I think we did a great job. And I will talk to you guys later.
Thank you. Let's
Bye
meet.
guys.
See
Nice
you
meeting you.
guys. Nice meeting you guys too.